Welcome back. This is Healthy India and we are talking about malaria today. So if you have a question that's related to this condition, this is your time to pick up your phone and call us at 1800115314 or 23035420. So right now we are joined by Pramod from Uttar Pradesh. Pramod, welcome to the show. Pramod, can you hear me please? Well, we seem to have lost Pramod. All right, now Dr. Arvind is talking about babies. What can you tell us as to how does, of course it would manifest itself in the same manner as it would in the adults.
No,
but
it doesn't.
It doesn't? All right. Oh, see, I'm not a doctor, no? So I can make those little, please allow me those little mistakes.
Yeah, so let me tell you that if you look at the baby when he's a neonate, that means he's just born, he can have malaria even at that point of time.
Oh, really?
So he's just born, so we call it as early neonatal period or early infancy. That time the baby will just be presenting with no fever, with anemia and hepatosplenomegaly, abdomen which is large.
Right.
He's got a protuberant belly and he's got a liver and a spleen which is large and he's got anemia. Anemia because there's hemolysis which is occurring. That is the only presentation that you have. And you have to diagnose these babies at that point of time and treat them as per the norms. This is early. So
this means it's very important for people to have institutional deliveries.
Absolutely, absolutely. Then you have the late neonatal period, or you have the, not the late neonatal, but the late infancy period. There the baby presents in three manners. The fever is again, it may be there, may not be there. Fever is a very mild component of the disease thereof. There the presentation is either GIT presentation or the respiratory presentation or the convulsions, CNS presentation.
Okay, it's to that extent.
Yeah. GIT means the baby will have diarrhea. It has severe diarrhea. The baby will have abdominal cramps. The baby will be sick. Then the baby may go into shock as a result. These are uncomplicated malaria cases. All this can occur in uncomplicated malaria. Then in the respiratory systems, then again the baby will have RALs. He'll have lots of pulmonary edema, as we call it. The respiratory rate is very high. Baby is breathing, having difficulty in breathing. That's the presentation. Then the baby starts convulsing. This is in the late neonatal period or in the early infancy period. Then comes the childhood period. That is the time when the characteristic features of the fever they set in.
Okay.
Like the adults, you know, they have the intermittent fever. There may be continuous fever also might be there, but intermittent fever is more common than the continuous fever. This point of time, the baby will be again having hepatosplenomegaly, liver and spleen is enlarged, and he will have fever, and the chills and rigors will also set in. This is the time where he starts aping the same phenomenon as the seen in adults.
Right.
Right. Then is the complicated cases. Complicated one is a very horrendous kind of a scenario. Then what happens is the baby will go into a state of he'll go into a state of stuprose, then he'll become comatose. He will start convulsing. Then he'll have cerebral palsy. He will have the palsies of the various cranial nerves. You see, I mean, he will have paralysis of the cranial nerves. I mean, he'll have a mouth which is gone a little haywire.
Right. Okay.
So that's the issue. Then there are issues where the liver also takes a beating, the kidney takes a beating.
So it's almost
and the
like
entire system that the multiple organs involvement becomes very rampant. The baby will eventually go into a very bad state.
Right. So all the more reason people that do not take these things easily, please. Well, it seems that Pramod is back from Uttarakhand. So Pramod, are you there now?
Yeah, ma'am.
All right. Welcome to the show. Please go ahead, Pramod.
Thanks. Ma'am, I just want to ask a question, and that is there any special kind of breed that causes malaria, and how can we identify it?
Special kind of?
How we can identify the mosquito actually that causes malaria?
All right. Well, so let's just direct this. Yeah. Anything else?
Yes, one more question I just want to ask, and that is the safest way to get away from those mosquitoes that cause malaria.
All right. Thank you for the question. So, Dr. Dhariwal, over to you, please.
See, it's very important, and I would thank Pramod to put in this question. As has been said, malaria is caused by a type of mosquito which is called as Anopheles. Now, to differentiate Anopheles from other mosquitoes, and most important one from today's context is the Aedes mosquito. Aedes causes dengue, Anopheles causes malaria, and the third major category is the Culex mosquitoes, which we call as the nuisance mosquitoes. Okay. And usually means in North India, this is the period, month of March and April, when we have a lot of problem of nuisance mosquitoes, which is predominantly a Culex mosquito.
That's an interesting name, nuisance. As it is, mosquitoes are a nuisance.
Yeah. So, Culex mosquito breeds in dirty water, in drains and wherever biological material is available. Anopheles and Aedes prefer clean water.
Okay.
And out of these also, the Aedes mosquito, which causes dengue, prefers small containers, means even as small as the cap of the Bisleri bottle. That is good enough to lay eggs of by the Aedes mosquito. And it's a we call it domestic or paradomestic container breeder. While on the contrary, the malaria mosquito prefers to breed outside, maybe the large water bodies, the flowing streams of the water, in the puddles of the rivers or small stream. Like in northeastern states, we have a mosquito which is called as the Anopheles minimus and dirus type of mosquitoes, which are considered to be very efficient vector. Efficient in the sense that mean just giving you an example, that single bite doesn't cause the disease. There has to be multiple bite. But in case of the mosquitoes which are prevalent in northeastern states of our country, minimus and dirus, even few bites are good enough to, so that is why we call it efficient vector. So these mosquitoes, they usually prefer in flowing water, Fluviatilis group of mosquitoes also. Now to coming to the question raised by Pramod, one can differentiate in the sense that the malaria mosquito usually bites, number one, in the night hours, dawn and dusk, that is number one. Number two, on the wing and on the leg, there won't be any strip, while in case of Aedes, there would be a strip, and that is why we call Aedes mosquitoes as the tiger mosquitoes. And the other important thing is that they usually, the method which they adopt when they stay on, then Anopheles usually makes an angle, and that is how you can differentiate. While Culex group of mosquitoes would sit parallel,
so one is to study even all
to
these
the
things
surface.
to know even about mosquitoes. All right. Well, we have another viewer. This is Mr. George from Gujarat. So, Mr. George, welcome to the show.
Good evening, sir.
Yes, sir. Please go ahead.
My question is to Dr. Dhariwal.
Yeah.
Good evening, sir. Sir, I would like to ask, because in urban area, the proportion of the patients going to the private practitioners are more. So, how the rapid diagnostic test can be provided to the private practitioners so that diagnosis is made early and complete treatment can be provided. So, how best we can provide this diagnostic facility to the private practitioners also, and whether the government can support this scheme in any manner, or that I would like to know.
Right. Yes, Dr.
Thanks, Dr. George, for raising this issue. Urban malaria is emerging as a big problem in our country, and involvement of the private sector is no doubt is very, very important. And the availability of rapid diagnostic kit, I would like to say that we need to have a system of good network of the microscopy center. And I would like to cite an example of Mumbai, where in one big hall about 80 to 100 laboratory technicians, they sit, and the slides from different part of the Mumbai, they come to that place. They have a system network, and then the slides are examined same day, and results are communicated over telephone or through internet to the different dispensaries, and that system is working very well. So, in urban areas, we should prefer to have a good network of the microscopy centers, but nevertheless we should provide, and particularly during emergency situation where microscopy would not be possible, as Dr. Saab has said that during emergency we need to diagnose it and then accordingly the correct treatment has to be started.
Right.
So, in those situations rapid diagnostic kits can be made available and it is available otherwise in the market, and those who are in the practicing sector, private sector, they can very well purchase it, procure it and then can use it.
Right.
But I would like to emphasize means those doctors who are in the private sector that we don't recommend use of the antibody based tests. It should be antigen based rapid diagnostic kits.
Well, we have another viewer from Haryana. This is Vijay. So, Vijay, if you are still with me, welcome to Healthy India.
Hi.
Yeah, please go ahead, Vijay.
Yeah, I have a question that I have two questions basically. One is that how safe are these repellents that we are using, which are liquid based or the smoke based coils,
right,
for daily use in this weather for like 3-4 months? And another question is, in Brazil, people are dealing with the same situation, but I think government is doing some efforts by sterilizing those mosquitoes. So when they breed, they are not going to breed any potent mosquitoes, so they stop breeding further. So is there anything like that? Is it a feasible solution in India also?
Interesting question, Vijay. Thank you so much. Well, let the first one go to Dr. Raheja and the second one to Dr. Dhariwal. Yes.
The first one is
repellents. How safe are the repellents?
Yes, I will tell you that these mosquito coils he particularly said.
Repellents.
Yeah, even the repellents and the coils he asked.
The mosquito coils, I think they should be used with caution, particularly in the closed environment. Because in one study, the mosquito coil can produce lot of toxins, and it can cause other respiratory diseases.
Correct.
So mosquito coils, if at all to be used, should be used in open and should be avoided otherwise. We have other vaporizing machines. Even they should be used with caution. If the person is allergic or asthmatic, then you have to take precaution. And the local application of mosquito repellents,
the creams,
yes, they are safe, but they should be again used in a very limited way. Particularly, I will say the mosquito repellent creams should be used for the children, those who are playing in the parks in the morning and evening hours, and not so frequently. I would like to say the safest thing is to use the mosquito nets, and we have the medicated nets also in the night, where a person can have mosquito free sleep without these. And the most important thing, but not the last, you should wear the full the clothing should be covering your arms, and your the children, those who are playing in the park, should have full pants with socks. And last but not the least, again I would like to say, you must prevent mosquito breeding. We have other fumigation also. The government does that fumigation with pyrethrum, malathion, but again they have a very limited role. And again, for the people, those who are allergic, asthmatics, they have to take precaution. And the second catch here is, moment there is a fumigation in the locality, the people tend to close their doors.
Right.
So inside it is ineffective. And even the mosquitoes, they tend to get into the deep burrows. So that way it is just a kind of thing which you can just go for a very limited role in a very peak particular season. Once the government policy says this is only done in those areas from where these cases are getting reported, like dengue or malaria.
Right.
But this is just to kind of tide over the situation. But the best way is that you must stop the mosquito breeding, and the simple way is that there should be no stagnation, collection of water inside your house, in your surroundings. Keep your house clean, keep your surrounding clean. Keep your city clean.
I think we've emphasized that so much.
Coming to the question about the repellent ones, 50% concentration of the repellent will keep the mosquitoes away for 12 hours.
Okay.
That's the ratio. And 25% creams will keep them about for 4 to 6 hours.
Okay.
So if you have a repellent cream, that's pretty safe for babies who are older than 2 months. And even for adults, it's pretty safe. For less than 2 months, then we won't recommend these creams. So you can decide on that one. If you, for 12 hours, you can have a 50% cream, which should remain for 12 hours, and then it remains okay, and you can have just 2 applications in a day. That's about it. And for the lesser ones, you keep on reducing the concentration, it becomes safer and more safer, but then the duration that it will last will be lesser.
That's right. Well, so before I go to Dr. Dhariwal, for the second part of the question, let's take this other viewer. This is Naveen now. So Naveen, welcome to the show.
Yeah, ma'am. Good evening, ma'am.
Good evening to you. What's your question?
Question was like Healthy India on malaria, ma'am. We were suggesting, that panel was suggesting some malaria, some ways to stop malarial parasites and all. Don't we all think that the MCD has a great role to play onto this, wherein some spraying and all should be carried out frequently by the MCD departments and all?
Right, that's exactly what we were talking about a while ago, about fumigation. All right, thank you so much, Naveen. But first, question first, Dr. Dhariwal. Now, I want you to answer what I think Vijay wanted to know, if I'm not wrong.
Right.
That are we going to replicate the Brazil model?
See, before going on to, because looking at the time, we should devote more time what is being done by the government and what is being done in India and what is available. Most important thing which has been said by Naveen also, that MCD or for that matter local health authorities have an important role to play.
Right.
Now in malaria, lot of funds, lot of energy is devoted to what we call as the indoor residual spray. That's in brief called as the IRS, for which chemical like DDT, synthetic pyrethroids are being used, and it's being done in those areas where malaria is highly prevalent. Means almost all villages of northeastern states where problem of malaria is more. Then twice in a year, we call it 2 rounds of IRS are being conducted, where person with the spray, they go and spray each and every room of the house, and that protects from the mosquito bite. Once the mosquito sits on the wall, will pick up that chemical and will die.
Correct.
So that is the strategy on which the malaria program of Government of India is working. And now coming on to that whether that model of Brazil, we also had our own model. In India also, this not a new technology, genetically modified, the male mosquitoes, male sterile mosquitoes were liberated, and it was done in India also 2 decades ago. But the experiences in India has been not very good.
Not very successful. All right.
Rather, community on the contrary said that the mosquitoes are already there and we are pushing more mosquitoes, although maybe male sterile mosquitoes. So work is going on, and on the same time there are other things also like Wolbachia is a bacteria which is being used. So that is another method on which we are working, means new methods. But the traditional method which Dr. Raheja said,
I
that
think
the
if
most
we
important
just follow those, that should be enough. Yeah. Well, so on that note, I think our time is also over. I'd like to say thank you to 3 of you for coming today and for talking about malaria. Well, I really wish we had more time to go into a few more details, but yes, viewers' questions are something that we take as our priority. So I do hope that we've been able to answer all your questions, and as we've been saying from this forum time and again, that please keep your surroundings clean. Don't let any water stagnate, even in those flower vases. Do remember that this is not the time to let that water stagnate. Do change that water every day or every alternate day, and keep your coolers clean, and anything that's lying in your house as cupboard, which we call, maybe some lids here or tires there and all that, just don't keep that. So if there's no water, there's going to be no mosquito breeding. They won't have a medium to lay eggs on, which means that you and I can be safe, because as the doctors here said, the complications could be very painful, so much so that the patient could even die. So I don't think anybody wants to die of malaria, at least. So let's all join our hands together with the efforts of the government and see to it that we are able to fight malaria and fight it well. So thank you so much for watching. Do catch me next week when we'll be taking up another health issue on Healthy India. Till then, this is Lottie Alaric saying goodbye, and take very good care of your surroundings, please.